If you have been dealing with heartburn for a while, you already know how draining it can be. It is not just a little burning in your chest. It can wear you down. It can make meals stressful. It can make sleep harder. It can leave you feeling heavy, tired, and frustrated, especially when you are trying to do everything right and still feel like your body is working against you. Maybe you notice it after dinner. Maybe it hits when you lie down. Maybe it wakes you up at night with that burning feeling in your chest or that sour taste in your throat. And over time, it starts to affect more than your stomach. Your energy drops. You move less. You gain weight more easily. You start avoiding certain foods, certain activities, even certain social situations, because you do not want to deal with that discomfort again. Hello. I am Dr. Arthur Sterling. I am glad you are here. In this video, I want to talk with you about how to stop heartburn fast, but also how to think about it in a smarter, calmer, more effective way. Because the truth is, quick relief matters, but understanding why it keeps happening matters even more. Let me explain. Heartburn is that burning feeling you get in the middle of your chest, usually after eating, or when you bend over, or when you lie down. It happens when stomach contents move upward into the tube that connects your mouth to your stomach. That area is not built to handle stomach acid. So when acid or partially digested food moves upward, it creates irritation, and you feel that familiar burn. Now, this matters more than you think. A lot of people assume heartburn is only about spicy food, or one heavy meal, or getting older. But in real life, it is often tied to patterns. It is tied to timing. It is tied to body position. It is tied to stress. It is tied to eating habits. It is tied to weight changes. It is tied to how your whole day is structured. That is why some people keep chasing short-term relief, but never really get ahead of the problem. They treat each episode like a random event, when in fact the body is often sending a very consistent message. If your goal is to stop heartburn fast, the first thing I want you to understand is this. The fastest relief often comes from reducing pressure and reducing irritation. That means what you do in the moment can make a real difference. If heartburn starts after a meal, do not lie down. Do not slump into the couch. Do not fold forward at the waist. Stay upright. Give your body some help from gravity. A gentle upright posture can reduce that upward movement and sometimes calm things down faster than people expect. A slow walk can also help some people. Not intense exercise. Not bending. Not a workout. Just gentle movement. A few minutes of easy walking after a meal may help food move along in a more comfortable way. It also keeps you from falling into the very habit that makes heartburn worse, which is eating and then immediately becoming still. Here is the important part. Fast relief is not always about adding something. Sometimes it is about removing the triggers that are keeping the fire going. A very large meal can do it. Eating too quickly can do it. Eating late at night can do it. Tight clothing around the waist can do it. Alcohol can do it. Heavy, greasy foods can do it. For some people, caffeine is part of the picture. For others, carbonated drinks are a problem. The point is not that every trigger affects every person. The point is that your body usually has patterns, even if you have not noticed them yet. One of the most overlooked reasons heartburn keeps showing up is timing. A lot of people eat dinner late, then sit, then lie down, then wonder why the burning starts an hour later. That sequence is incredibly common. It is not weakness. It is not your imagination. It is physiology. When your stomach is full, and you lie flat too soon, you make it easier for stomach contents to move upward. So if you want faster relief today, and fewer episodes tomorrow, one of the simplest changes is to create more space between your last meal and bedtime. That one habit can make a major difference for a lot of people. Another thing many people miss is portion size. People often focus only on what they eat. But how much they eat matters too. A very healthy meal can still trigger heartburn if it is too large. An overfilled stomach creates pressure. More pressure increases the chance that contents move the wrong way. So if your symptoms are frequent, it is worth paying attention not only to ingredients, but also to volume. What I want you to understand is that heartburn can quietly affect almost every part of daily life. It can reduce your energy because poor sleep catches up with you. It can affect your weight because people who feel uncomfortable after meals often move less. It can affect your mobility because bloating and burning make walking, stretching, and exercise feel harder. It can affect your mood because chronic discomfort makes people irritable, discouraged, and mentally exhausted. And then that cycle feeds itself. You feel bad, so you move less. You move less, so your digestion slows down. You sleep poorly, so you crave heavier food. Then the next day becomes harder. That is why I do not want you to think of heartburn as a small nuisance. I want you to think of it as a signal. Not a reason to panic, but a reason to pay attention. Some signs are easy to miss. A sour taste in your mouth in the morning. A dry cough that seems to show up at night. Hoarseness that comes and goes. Feeling like food is coming back up. Needing to clear your throat often. A feeling of pressure in your chest after meals. These are symptoms many people brush off. They blame allergies. They blame age. They blame stress. Sometimes those factors play a role. But sometimes heartburn is part of the story. And here is where people get tripped up. They think, if I do not feel a dramatic burn, it must not be heartburn. That is not always true. Some people have more throat symptoms than chest symptoms. Some people mainly notice sleep disruption. Some people feel full, heavy, and uncomfortable after eating, and do not immediately connect it to reflux. Now, if you are asking how to stop heartburn fast, you are probably also asking a bigger question under the surface. Why is this happening to me now? That is the question I would want you to explore. Sometimes it starts after weight gain. Sometimes it starts after a period of stress. Sometimes it shows up during a season of less movement. Sometimes your schedule changes. Your meals get later. Your sleep gets worse. And suddenly your body is much more sensitive than it used to be. That does not mean something terrible is happening. But it does mean your routine may be playing a larger role than you realize. Let me explain another piece. Abdominal pressure matters. This is one reason heartburn often gets worse with extra weight around the midsection. Or with tight belts, tight waistbands, or sitting in a compressed position for long periods. Your body is mechanical as well as chemical. Posture matters. Pressure matters. Space matters. That is also why even small daily habits can have a strong effect. Eating slower. Chewing more thoroughly. Avoiding oversized meals. Giving yourself time to digest before bed. Walking a little after dinner. Paying attention to which foods are actually a problem for you. Not just which foods people online say are bad. These habits may sound simple. But simple does not mean weak. In medicine, the basics often matter more than people expect. Here is the important part. Do not fall into the trap of trying to fix heartburn while ignoring the rest of your health. If your sleep is poor, your stress is high, your meals are rushed, your weight is climbing, and your movement is low, heartburn may be one piece of a bigger picture. When you improve the full routine, the symptom often becomes easier to manage. This is especially important if you have reached a point where you feel like your health is slipping. Maybe your energy is lower than it used to be. Maybe you feel heavier in your body. Maybe walking upstairs feels harder. Maybe you feel older than you want to feel. Heartburn may not be the only reason, but it can absolutely add to that burden. It makes eating less enjoyable. It interrupts sleep. It can make you afraid of normal meals. Over time, that wears people down. What I want you to understand is that relief is not only about stopping the burn in one moment. It is about helping your body become less likely to create that burn in the first place. That is where tracking your own patterns becomes so useful. You do not need anything complicated. Just notice when symptoms happen. What did you eat? How much did you eat? How fast did you eat? What time was it? Were you stressed? Did you lie down afterward? Did you sleep poorly the night before? Did symptoms come after certain drinks? Did they happen more on weekends? When you begin to see the pattern, you move from guessing to understanding. And that changes the conversation you can have with your doctor. Instead of saying, "I get heartburn sometimes," you can say, "I notice it most often after large evening meals, especially when I eat late and lie down within an hour." Or, "I notice it is worse when I am under stress and sleeping badly." Or, "I wake up with a sour taste and throat irritation 3 mornings a week." That kind of detail helps your doctor think more clearly with you. Here are some smart questions you can bring to your next appointment. Could my eating schedule be part of this? Are my symptoms consistent with simple reflux? Or do they suggest something else? Are there warning signs I should watch for? Could my weight, sleep habits, or stress level be making this worse? Is there anything in my current treatment plan for other conditions that could be contributing? What lifestyle changes would make the biggest difference for my situation? Those are strong questions. They move the discussion forward. Now, this matters more than you think. Heartburn is common. But common does not mean meaningless. If symptoms are frequent, worsening, waking you up often, interfering with meals, or affecting your quality of life, that deserves attention. If you have trouble swallowing, pain with swallowing, unexplained weight loss, repeated vomiting, black stools, or chest pain that feels severe, unusual, or concerning, you should seek medical care right away. And if chest discomfort ever makes you wonder whether it could be heart-related, do not assume it is only heartburn. Get evaluated urgently. I also want to say something that people need to hear. You are not failing if you still struggle with this. Many people feel embarrassed by digestive symptoms. They think they should be able to handle it on their own. But the body changes over time. Stress changes the body. Sleep changes the body. Weight changes the body. Your system today may not react the way it did 10 years ago. That is not a moral issue. It is a health issue. And it deserves a thoughtful response. Let me bring this together. If you want to stop heartburn fast, stay upright. Avoid lying down after eating. Keep meals smaller. Notice your triggers. Reduce late-night eating. Give your body time to digest. Use gentle movement instead of collapsing into stillness right after meals. Watch your clothing pressure around the waist. Pay attention to sleep, stress, and weight trends. And most importantly, start looking for patterns instead of waiting for the next flare. That is how you move from reacting to heartburn to understanding it. And once you understand it, you often feel something just as important as relief. You feel control. You feel less confused. You feel less trapped by your own body. You begin to realize that your symptoms are not random. They are information. And when you listen carefully, your next steps become much clearer. You do not need perfection. You do not need to fear every meal. You do not need to feel discouraged because your body is asking for a little more care. Start with awareness. Start with timing. Start with posture. Start with simple habits that lower the chance of reflux. Then bring those observations to your doctor. And work from there. I am Dr. Arthur Sterling. Thank you for spending this time with me. Take care of your body. Pay attention to what it is telling you. And remember, small, steady changes often do more for long-term health than dramatic short-lived fixes. This video is for general education only. It is not medical advice. And it is not a diagnosis or a treatment plan. Do not start, stop, or change any treatment without speaking with your own doctor. If your symptoms are severe, persistent, unusual, or getting worse, seek medical care promptly. And if you ever have chest pain that could be related to your heart, call emergency services right away.